I'm going to get started with the first presentation today, and that presentation is called Current Status of Respite in Nevada, and it is a panel discussion with 3 experts that are very respected in the state of Nevada. I'm going to read just a short bio on the 3 people, and then we'll get them started. First of all is Cheyenne Pasquale, and Cheyenne serves as a planning chief at the Aging and Disability Services Division. In this position, Cheyenne oversees no wrong door planning efforts, grant management activities. She is the support for ADSD councils and commissions. She has development of discretionary grant applications and coordinates strategic planning efforts in line with state and federal priorities. Prior to this position, she served as the No Wrong Door coordinator to develop a network of support that helps individuals and families navigate the long-term services and supports, the support system. She began her public service working in a nonprofit organizations that provided services for people with disabilities. Cheyenne has had more than 20 years of experience working with older adults, people with disabilities, and their caregivers. She specializes in grant writing, program management, and systems change in the public sector. She received her master's in public administration from the University of Nevada, Las Vegas. So Cheyenne is one of the panel that is going to be discussing the status of respite care in Nevada. Second, I have Susan Haas, and Susan Haas was born in Hampton Roads, Virginia. As a Navy buff or brat, she and her family lived in Illinois, Washington, Guam, Florida, California, Arizona, and then settled in Bella Chase, Louisiana. Upon graduation from Bella Chase High School, she attended Seoul Business College in New Orleans, then enlisted in the U.S. Navy. Susan served honorably in the Navy for 4 years, used her GI Bill to attend the University of Toledo, and holds a degree in marketing and sales. Susan moved to Carson City in 1989 and worked for Frontier Tours as a tour designer. In 1999, she began work with the state of Nevada in the office of the Lieutenant Governor. And in 2001, she became the deputy chief overseeing the Capitol office in Carson City. Ms. Haas has over 25 years of program design, development, management, and marketing experience. Sorry, my paper is stuck here. Susan joined Nevada Rural RSV, the Nevada Rural RSVP program as the program director in 2007. She was promoted to the Director of Development and Marketing, and then appointed as Interim Executive Director, then Executive Director and CEO in 2013. Ms. Haas, with RSVP staff and field representatives, along with volunteers, provide programs designed to deliver person-centered care and care partnerships to assist elders and disabled persons to remain independent and in their own home with dignity. Susan, we appreciate everything that you've done. Corey Lutz is our 3rd panel presenter today, and Corey earned her associate degree in criminal justice at Truckee Meadows Community College and UNR in 1992. Since May of 2009, Corey has served in many roles for Helping Hands of Vegas Valley, a local nonprofit organization that began in 2000. She provides no-cost services to low-income, frail elderly in the Las Vegas Valley. She started as the transportation manager and then moved on to the respite and pantry coordinator. As the program grew, Corey took over the respite program solely. She also serves on the board for the Nevada Lifespan Respite Care Coalition, which again seeks to support caregivers in our state by promoting awareness and access to, as well as coordination and advocacy for respite services in Nevada through the lifespan. Corey, we appreciate your diligent service, and none of us know how you can take on all these hats. So thank you all for the three very respected speakers, and I am going to turn it over to the three of them. They will be talking on with a discussion on the current status of respite in Nevada. I'm not sure which one of them is going to go first, but I have Cheyenne listed first. I don't know if that's the order you're going to proceed or not. So welcome all three of you. Thank you so much for volunteering to present today with your busy schedule.
Thank you, Sue. And this is Cheyenne Pasquale. Thank you for having us today. I'm going to give a 10,000-foot view of respite services in Nevada. And I don't think I clicked the right button. And then I will turn it over to my fellow panelists, Corey and Susan, to really dig into their perspective and experience with respite services. So before I get started, have you guys heard the forecast for today? It's chilly today, hot tamale. Okay. So with that, we'll go ahead and get started. Like I said, this is just going to be a 10,000-foot view. So here we go. Maybe. Okay. So respite services, as many of us are aware, is a break from caregiving through in-home services, temporary facility placements, adult daycare, or any number of services. With public options, there's qualifications looking at income, resources, age, disability type, but also people seek respite through informal supports and private pay options. And the bulk of the presentation today, what I'm going to be talking about is the 10,000-foot view of the public options that are available. So when we think about respite providers, there's public programs, there's family members, friends, private businesses, nonprofit organizations, a whole network of providers out there that can help individuals get a break from their caregiving. In the state government, we have basically two types of respite. There is what we call pass-through funding, and then we have some direct service programs. So the bulk of our pass-through funding that's available in Nevada comes from two different agencies. First, within the Department of Health and Human Services, the Grant Management Unit has a fund for Healthy Nevada, which is for individuals under 60, and a portion of this fund can be used for respite. And this is outlined in the Nevada Revised Statute. On the other side, Aging and Disability Services Division has pass-through funding through the Older Americans Act, serving people age 60 and older, as well as a fund for Healthy Nevada that is defined in statute to be served people age 60 and above. So this pass-through funding is awarded out to community providers to provide respite to family caregivers. This can be in the form of direct services or in the form of vouchers, any slew of things. In terms of direct service programs, the Aging and Disability Services Division has a few options. Through our Medicaid home and community-based waivers, which is the waiver for elderly individuals, individuals with physical disabilities, and individuals with intellectual and developmental disabilities, there are respite services available as part of the waiver package. The Intellectual and Developmental Disabilities Unit also has a state-funded respite program that families can tap into. Additionally, through the Division of Child and Family Services and their system of care, they offer wraparound services for children with mental health concerns and other challenges. And those part of those wraparound services can include respite. So now I think it's really going to be important to hear from the experts, our boots on the grounds individuals. And so I'm going to go ahead and turn it over to Corey Lutz and Susan Haas.
Susan, why don't you go ahead and start?
Good morning, everyone. Thank you, Susan Goulas and NLRCC for hosting this summit. It's been a process, and I was kind of part of the planning of it, and it's really exciting to see this come to fruition. I think many of you know that one of the main goals of NLRCC is to help people to understand that respite is a normal part of life. We want to normalize respite. We want that to be something that people automatically say, okay, now it's time for me to get some help so that I can take care of myself, so that I can continue this wonderful caregiving that I'm giving to my loved one or to whomever I am a caregiver to. RSVP has been working with respite for many years, and we are really, one of the main things that we want to do is to provide volunteers that are well prepared for their assignments. And so there's a real process that goes on with orientation and training. And I think one of the key components of RSVP volunteer program is that we have volunteer leaders in key areas across rural Nevada and some in Washoe. And these volunteer leaders bring the volunteers in and help nurture them and help them work with the families and have the families accept that care. And I think probably all of you know, it's very difficult for family members to let go and to be more than understand that they are not only the caregiver, but they have a life themselves and they are many things. And so it's really imperative that we establish trust, and having these frontline volunteers out in rural Nevada who can interface with the family and provide the volunteer client introduction and volunteer client match, trying to find the right volunteer to meld with that family and set up a service plan and a schedule of services, and to continually do quality control to make sure that everyone is happy with the arrangement and that they're getting the care that they need. Another key component is referrals, to be able to refer these families for other needs that they may have, whether it be for food or housing. Many of our veterans need suicide prevention and awareness contacts. So I think melding into the community, being a part of the community, and being a natural resource for people that are in the community is one of the key components that is so important. That's all I have for right now. If anyone has any questions, please let me know. We do have a small but mighty team of volunteers. We have volunteers in Carson City, Douglas County, Elko, Humboldt County, Lincoln County, Lyon County, Mineral County, Nye County, Esmeralda County, Washoe, and White Pine County. And these individuals, as I said, are well prepared for their assignment. We provide respite orientation and training, dementia friends training, and any other opportunity that we can find, especially working with the Alzheimer's Association and trying to help educate these families and provide them with, again, other resources, whether it be vouchers or other organizations that might be able to feather in and provide that additional support, which is so necessary. Thank you.
Great job, Susan and Cheyenne. Hi, I'm Corey Lutz with Helping Hands of Vegas Valley. I've been with them for about 11 years now. Been the respite manager for the past 9, maybe 10. And our organization is lucky enough to get some of the funding that Cheyenne spoke about. We get some of our funding from the Older American Act and from Healthy Fund Nevada. Helping Hands of Vegas Valley, I'm going to give a brief overview and then we'll go back into the respite. We provide 4 programs: food pantry, transportation, respite, and minor home repair. During the pandemic, we started quite a few new food pantry programs to help make sure the seniors of Vegas Valley were fed. We have some home delivered meals similar to like Catholic Charities Meals on Wheels, that these are fresh and frozen. We have walk-up pantry, we have upped our delivery, emergency food pantry, and we've also started a program where we will go shopping for the senior at Vaughn's at our expense up to $50, and we deliver it to them, no contact. For just a few of our programs, but we're here to learn about respite today. So our respite vouchers are vouchers. We collaborate with many organizations. We collaborate closely with Nevada Senior Services and the Alzheimer's Association, and the vouchers reach 4 counties for Southern Nevada. So we are trying to reach as many rural areas as possible. We reach Clark, Lincoln, Nye, and Esmeralda. There's always a challenge in the rurals, and that's where wonderful agencies like RSVP come into play, because theirs are volunteer-based and mine is not at this time. It's not a direct service. You don't get to pick your provider or your friend to be your provider. You have to have an agency. During the pandemic, this evolved a little bit. We were trying to find different ways of doing this, and hopefully some of these ways will continue. Maybe, seniors learning Zoom, or Teams, or Skype, or FaceTime if you have iPhones. These were some of the ways, since we couldn't have contact, we were trying to think outside the box, and we got a lot of that done. I know Cheryl Donnell with Respite RX headed that, and she was wonderful at coming up with ideas and rave for the kids. So throughout the state, we have all come up with some really innovative ways to keep respite going during the pandemic, because it's just as important, and probably more important, when you were locked in and you had no break, because mental health gets very, becomes a huge question at that point. We need to keep our sanity, and can't really do that when you can't go out and work. So our respite vouchers reach about, we give out about 600 vouchers every fiscal year. Unfortunately, some of those get returned, so we, have to deal with that, and then we reallocate those funds, and we go from there. My grants are used with at-home agencies, ones that come into the home, adult daycares, or at-stay communities, which is, as you can imagine, more of a challenge right now, because they're not necessarily being let into the at-stay communities or group homes just because of COVID. pretty much that is all I have. Just keep up the great work, anybody. Does anybody have any questions for any of the three of us?
There's two questions in the chat. So the first question says, besides physical and aging needs for seniors and disabled, are volunteers trained in communication skills needed to work with emotional need and PTSD?
Susan, that's a you question since we don't deal with volunteers.
Well, the Respite Education Support Tools provides a fantastic training for volunteers. It's actually an 8-hour training. And part of what is discussed, in fact, a good part of what is discussed, is communication. And I think the most important thing that volunteers and caregivers in general have to realize is to put themselves in the place of the caregiver and look where they are coming from. Where are their needs? And to be creative about how to communicate with them. If they cannot speak, let's start looking at pictures. Let's have a board. If they have difficulty holding things, let's take a scrunchie and attach a cup to their hand so that they can shake and throw out the dice for Yahtzee. So you need to kind of look at who are we working with? What are their needs? Check yourself at the door and totally focus on that person. And we are able to work with adults living with a disability as well. People aged 18 and older throughout that range of spectrum. So yes, I think it's extremely important to practice active listening, to understand that if someone's on the autism spectrum, that lights and sounds are going to be extremely intensified sometimes. So you may need a weighted blanket. You may need to play some soothing music. You may need to redirect. If someone is going over and over about something, redirect. Let's go into a different room. Let's change that atmosphere. And it takes time to get to know the care partnership. It's not just the caregiver, it's a care partnership. And working together, we all benefit because we learn from those we are caring for, as well as the community that surrounds and supports us, whether it be aging and disability services or other agencies, social workers, doctors, friends, family, and the community, all working together, creating that care partnership. We're able to work together and learn and be elevated. And I think we all gain from it. It's not just a one-way street where the care recipient receives all the love and attention and care. We ourselves derive so much from that care partnership.
Thank you, Susan. There was another question about training. What about ethnic differences and needs? Is that?
Yes, that's extremely important to again, understanding who you're working with and respecting their culture and the way that they conduct their lives and their family. And so that's where really sitting down and talking to the family, talking to the primary caregiver, and understanding whether it be we don't eat meat or we have certain practices that we observe, whatever that may be, to really communicate with that primary caregiver and the care recipient, because it's so important not to forget that they are an active part of this. Look them in the eye, talk to them if they are able to communicate that way. However they can communicate, work with them to find out what their desires, what their needs are. And so again, absolutely, we need to respect and model our caregiving in conjunction with the primary caregiver so that they feel comfortable, they feel safe, and that they feel willing to accept the care that they so desperately need.
Thank you, Susan. And you mentioned already that you are able to serve individuals age 18 and over through your organization. Corey, what about you? What is your
Organization, yeah, Helping Hands of Vegas Valley, we just expanded ours a little bit. Primarily, we are 60 and over for most things, but we do have a new thing for this last fiscal year, or for this most current year, where we can accept patients with a diagnosis of dementia or some form of Alzheimer's. So that can be at any age. So other than that, we do refer to like Desert Regional for youth, or in the South, Rave in the North, and the Desert Sierra Regional up in the North as well for children and things. There are other agencies, Easter Seals and stuff like that, that can help with diagnoses that are specific to the areas they serve.
This is Sue Goulis. There's a question in the chat about eligibility and criteria for respite. Some people want to know, are respite volunteers only available to low-income families? So could you two talk about that for a moment?
Yes, there's no real threshold. You know, our focus is on the low, you know, we try to assist low income people, but how is that defined? You know, you may have a family that worked their whole life and they have a beautiful home, and but you know, they're living on a really tight budget. So we do ask for that information. We collect that data, and it is a focus because low-income people have less opportunity, but it is not a requirement. And I just also wanted to touch base about the persons living with dementia and how important it is to realize that people with a diagnosis of dementia are still people. They have so much to contribute to the community and society. And as I mentioned earlier, it's so important to look at them and talk to them. Many times the primary caregiver will sort of take over, and the person living with dementia no longer has a voice. And so it's so important for those that are living with Alzheimer's or some kind of cognitive impairment or dementia to have the opportunity to interact with the community as much as possible. And this helps slow the dementia. From what I've been hearing, that having that communication and contact with the community helps so much.
That is 100% true, Susan. So for my program, we are same. A lot of it is data capture. For the income, it is self-reported if you're above or below poverty. But if you're above poverty, I'm not going to deny you a respite voucher. You're going to get it. We usually have to have a certain percentage in the low income range, and that is unfortunately not hard to get. So that's not a huge concern in my thought process, because everybody needs a break regardless of what money you have or don't have. So that's how we sort of look at it. So somebody asked about Ray available in the Las Vegas area. Corinne will be speaking in a little while, and that is a question you can ask her during her speech. She'll be speaking from 10:45 to 11:15. So we'll table that one for right now. And somebody else asked about the ethnic differences. So for my program, what I do, since I do work with agencies only, I ask those agencies to advise me what languages they speak, and it's all listed on my agency list for that. So if they speak multiple languages, the patient and the caregiver can look at that list and see that agency XYZ speaks Russian, Spanish, Tagalog, etc. That way they can make a better informed decision on what agency they want. Plus we, if they don't know how to interview an agency over the phone, we do help with those kind of questions. We do have some from the state has a list of questions, so we advise them on that as well. You know, do they want a male to help with a male, or a female, or somebody that's, you know, those are specific concerns and questions that we get a lot, and we answer them accordingly. Is there any other questions that you see that I missed, Cheyenne?
No, I think you
so.
got
We can
them all,
open
Cory.
it up. Yeah, we can open it
Yeah.
up if there's anybody that wants to
Well,
ask a question out loud.
Sure.
I don't know if the
I
option is
had
available.
one question that, yeah, I had one question that I thought the audience might like to know a little bit about. I know we have Dr. Coleman talking tomorrow on coronavirus, but I think it would be helpful if the three of you could talk about coronavirus, and has that limited your ability to provide respite, and how are you handling your respite with coronavirus?
Well, when the pandemic hit, the first thing that we did was to pull back on personal contact, obviously. And we shifted into telephone reassurance. And we are still doing a lot of telephone reassurance. And some of the families just are not ready to have anyone come into the home, but others are. And so we are practicing safe, social distancing and wearing masks, washing the hands frequently. And so we are able to continue. We do have a program called Friends Day Out, featuring the Java Music Club. And this is a program where we bring people together and we have a theme and we talk about different topics and we play music and sing songs. And this is an evidence-based program that shows that this helps people with dementia, cognitive disabilities, and other disabilities such as Parkinson's, or just folks that, they're getting older and they need social contact. So we are doing some of that outside. We have a place in Carson City, the home of one of our families, that we are able to social distance and play music and talk and sing songs. So we hope to be able to continue that and expand that. And moving forward, we hope to do more of the actual in-person respite. But we're doing a lot of the telephone reassurance, talking to the volunteers, talking to the primary caregivers, and talking to the care recipients as well. So it's definitely challenging because it's such personalized care. It's mostly in the home, but sometimes we can get folks out of the home in a safe and socially distanced manner with masks and whatnot, so that we can continue to provide that service. But definitely, it put a blanket over everything, and we've switched to providing the primary caregiver with services like going shopping for them, picking up their prescriptions, going to pick up their mail. You know, we became concerned when, you know, the government was giving out the stimulus checks about fraud and people, you know, getting a hold of those checks. And so one of the other things that we have been providing is mail pickup for the family caregivers.
Thank you so much, Susan. Corey, we have about 1 to 2 minutes. Do you want to just mention how coronavirus has affected your program?
We had a lot of the same. We had a lot of people that did not want to have people in from the agencies due to the virus and fear of contact. All of the agencies took that in stride, and you know, they backed off a little bit if that's what the person wanted. They obviously are following all required PPEs, masks, gloves, shields if need be, and hand washing and stuff like that. So what happened with us is we were trying to do telephone reassurance as well, and email reassurance, and referring people to the Nest Collaborative or Nevada Can. And also we extended their voucher time period so they could use it once. If it expired during that time, we extended it so they could utilize the funds after they felt it was okay to have somebody back in their home.
Thank you, all three of you, so much. There is a question in the chat, and I'll defer that to our Zoom coordinator, Marcia. They wanted to know about the meeting being recorded, and would they be able to view it after it's completed.
Yes, we are recording, and we'll let you know when it's available to be viewed later.
May I just say one last thing? I am retiring from RSVP on September 17th, and I just want to let everyone know how meaningful it has been in my professional career and personally to be a part of respite care. This has meant so much to me and the caregivers and clients. So thank you so much for all of the opportunities to serve, and I'll miss you all. Thank you.
Thanks so much, Susan. You will sorely be missed. So thanks so much.